welcome and thanks for attending this webinar. I just have a short note before we get started. I've decided to add a brief discussion about the use of infrared saunas at the end of this webinar, so if you have a little extra time, you're welcome to stay around and listen to the short presentation. And the reason why I added this topic is because infrared saunas, they're a great way to detoxify the body, in patients that can't tolerate ingestion of detoxification substances. That's due to, like, if they have poor liver function, kidney function, or gastrointestinal function. So it's a great way to detoxify, without having to give them something, and if their, detoxification systems are compromised. All right, so let's get started. As you know, the thyroid's a small gland. It is shaped like a butterfly, and it rests in the middle part of the lower neck. And its primary function is to control the body's metabolism by the hormones it produces, and that you probably know it's T3 and then T4. Essentially these hormones, they'll tell the cells of the body how much energy to use, so keep that in mind. Okay. Conventionally speaking, there are several different types of thyroid disease, which are generally placed into two categories, as you see here: nutritional deficiency and thyroiditis. As most of you know, iodine, when it's deficient, is a primary nutrient involved in involved in thyroid disease and dysfunction. There are other nutrients to consider as it relates to thyroid function. Think about selenium, zinc, iron, which we'll go over extensively in this webinar, and the amino acid tyrosine, which is the amino acid building block of the thyroid hormones. So I want you to think about the individual with known gastrointestinal malabsorption. If they're not absorbing their nutrients, think of the effect that will have. They're not getting enough selenium, enough zinc, enough iron, and the proper amino acids, the proper protein, and particularly the amino acid tyrosine. So you need to think about that. If these raw materials, they're needed by the gland to produce the hormones, and if they're not there, there's thyroid disease all by itself due to a gastrointestinal malabsorption. So that's the kind of thinking I want you to keep with you as we go through this webinar tonight. So this slide shows thyroiditis. So what that refers to, as you know, itis is inflammation, so this is an inflammation of the gland. So we need to know what potentially can cause the gland to inflame. Problems with the immune system, that makes sense. Viruses, bacteria, fever disorders are all known to cause thyroiditis. And sometimes thyroiditis develops as a part of Graves' disease, which is an autoimmune disorder that causes hyperthyroidism. There are certain drugs that patients will be given. One is amiodarone. That's given for patients that have arrhythmias. That has a direct effect on iodine and can inflame the gland. So again, you need to get a good history, find out what medications that your patients are taking. Other medications include stuff like interferon, interleukin, if they're on lithium. All of those can cause thyroiditis, so you definitely need to keep that in mind. That'd be certainly part of your patient history. However, the inflammation with thyroiditis is mainly attributed to autoimmune disease, similar to juvenile diabetes or rheumatoid arthritis. So the autoimmune is big here. Some type of immune dysregulation is going on in most of the cases. So definitely keep that in mind. There's one condition, disease, I know you've probably heard about, Hashimoto's disease, and it's referred to by several different names: Hashimoto's thyroiditis, autoimmune thyroiditis. It also shows up as chronic lymphocytic thyroiditis. The point is that this is the most common cause of hypothyroidism found in the United States. Essentially what happens is that antibodies in this disease, and this is an autoimmune disease, the antibodies are created that react against the proteins in the thyroid gland, and they start to destroy the gland. Essentially this makes the gland unable to produce thyroid hormones. As you look at this slide, just take a look on the right side, and if you go, say 1, 2, 3, 4 slides down, you see a condition called postpartum thyroiditis, and you look to the right, autoimmune disease. So essentially, postpartum thyroiditis, it occurs in about 5 to 9% of women after giving birth. I personally think that this is related to a pre-existing hormonal immune system imbalance, but it can also be due to an energy imbalance, as you well know. You'll see on this slide that the majority of conditions that cause thyroiditis are, the immune system dysregulation somewhere along the line. So you definitely need to keep that in mind. One big area that I'm sure you hear on commercials and people talking about it, where most of the immune system in the body is found is in the GI tract. So that's something that always needs to be considered with any type of immune dysregulation, and particularly autoimmune disease. So you need to keep that in mind. You know, as practitioners of acupuncture, you're all aware that the body is, is regarded as an organic entity, in which various organs and tissues and other parts have distinct function, but they are all interdependent. They rely on one another. And essentially that means that health and disease, as it relates to the balance of functions, it relates to the balance of function in the body systems. This is very similar to functional medicine. I mean, we look at this, as almost the same aim approach as traditional Chinese medicine, or yourselves as acupuncturists. We're looking for other, for causes of dysfunction, whether that be energy balance, the GI system, oxidative stress, and then we'll review those as the lesson proceeds. This is kind of a fun part. By the way, this is all being recorded, and I think Dr. Grisani will be sending you a recording of this. So while we do this section very quickly, I just want you to kind of sit back, and I'm going to do a little guided imagery with you, so just hang in there for a minute. And so we're going to look at the physical signs of deficiency as it relates to thyroid dysfunction, but you can look at other conditions that your patients will have, looking at the physical signs. I put this in there because I believe that a certain aspect of the healthcare professions, they seem to have forgotten the art of observing the patient for the presence of disease and physiological function. And I personally believe that the advancement of diagnostic testing and the formation of medical specialties may have led to this decline. This is a very powerful tool. And again, like I said, with that said, I want to do a short guided imagery with you to enhance your observational skills as it relates to individuals with suspected or known thyroid dysfunction. So, this short exercise, it'll provide you with the thought process, or what they call the paradigm of the functional medicine approach to disease. I believe all of traditional Chinese medicine, the powers of observation are there. I know, looking, the pulse, looking at the tongue, looking at the skin, the eyes. Most of you have this down. I just want to kind of narrow it down to that we do it as well, and how we would look for a patient with thyroid dysfunction. So this is just a very narrow window, but I think it'll be some fun. All right, so let's get started here. So what I want you to do is I want you to imagine that you're walking into your waiting room ready to greet a patient after you've read all the patient information. As you approach the patient, you have your hand extended ready to greet them, and you notice first thing as you see here on the slide, puffiness in the eyes. In your mind you need to ask yourself, what's causing the excessive accumulation of fluid in this person? I mean, you all know that as Chinese medicine, from a Chinese medicine perspective, that this can indicate poor kidney or adrenal function. From a functional medicine and integrative medicine perspective, we'll take that a little bit further, and we'll look at, the accumulation of the eyes can be caused by thyroid, liver, heart, and kidneys, as well as dietary factors. So this is going to add more power to your power of observation. So, so in functional medicine, you'll learn that the liver and the kidneys, they're the site of what they call peripheral conversion of the thyroid hormones. And I know that kind of was a mouthful, but what that means is that the thyroid gland produces two active thyroid hormones, T4 and then T3. Very little T3 gets put out into the body to control metabolism, but the T3 is more active. Parts of the body, meaning the liver and the kidneys, they will convert the T4 into the more active T3, which is 5 times more active. So when you think about it, if there's a problem with the liver in particular, because most of it happens there, or the kidneys, that the T4 hormone, which is not as active as the T3, okay, can cause like hypothyroid symptoms, liver congestion, liver disease, kidney disease. That could be the source of hypothyroidism. So you definitely need to keep that in mind, because a lot of the symptoms will be the same. So that's how looking at just, not looking at the gland itself dysfunction, but looking at, is there a problem with conversion in the periphery? Because there's a lot of things go on, in the liver, a lot of chemical reactions. We often think of the liver as detoxification, production of bile, and so forth, but it's a major site for converting the T4 hormone to the more active, again, 5 times more active T3 hormone in the body. So that'll give you some kind of an idea. When you look at adrenal dysfunction, as you know, in traditional Chinese medicine, we'll look at that as high cortisol levels. If the body is under a lot of stress, the last thing it wants to do is create more stress. It's looking for a way to dampen or put the brakes on. It's kind of interesting that with high cortisol levels in the body, the high cortisol will take the T4 that's a lot more, in the bloodstream, okay, and it will convert it instead of T3 to what's known as reverse T3, which is a metabolically inactive form of T3. Essentially, what the adrenals are trying to do is say, you don't need any more energy, I'm already burned out, so I'm going to take that T3 and convert it to reverse T3, essentially to prevent, in an attempt to prevent total adrenal burnout. I hope this kind of makes sense to you. When you're looking at the energy systems of the adrenals and the liver, that's how balancing those out can help with thyroid dysfunction, without having to give the patient a ton of supplements for the thyroid gland when you look at these other areas. So anyway, well, back to your patient. If you now take a look at your patient, in the waiting room, you notice they have dark circles under their eyes. So essentially in functional medicine, you'll learn, and you certainly can learn that with traditional Chinese medicine, this could be a sign of anemia, sign of allergies, nasal congestion, or poor vascularity throughout the body from cardiovascular disease. With regards to allergies, which we see a lot, you'll learn in functional medicine, and you probably know this already, that gluten sensitivity is directly related to thyroid dysfunction. And that's via immune system dysregulation. The proteins and gluten sensitivity, the gliadin and so forth, will cause a dysregulation of the immune system, fire up some antibodies. I'll talk about that a little bit later. That can go after the thyroid and damage it. So that's one of the big things on how gluten works, and I'll talk about that a little bit later in the webinar. So the last thing on this slide is, of course, you see the term goiter. I want you to visualize your patient sitting on the exam table. You're looking at the front of their neck, and you notice the enlargement. If you're not looking in the front of their necks, trust me, I do this every day in my practice, and at least 3 times a week, I notice there's on a patient that's coming in that there is an enlarged thyroid. They're not telling me anything. I mean, it's kind of weird. I wind up staring at most people's necks. They come into the office. We just see so much. I'm on the East Coast, and there is a lot of autoimmune disease going on. I just automatically look for it. So if you do see enlargement, you need to ask yourself a couple questions here. Is it due to hyperthyroidism, which will cause an enlargement? Hypothyroidism can also do it. Is there a tumor process going on, or is this an iodine deficiency? Part of the training in our course, you'll learn how to assess for these conditions, and also the correct procedure to palpate the thyroid gland for the presence of disease. Many times when patients come in, I often ask them, they usually, for chronic disease patients, you all know this very well, they've usually been seen by someone else before they got to you. And I'll say, did the clinician prior to me seeing you, did they put their hands on your neck and palpate the thyroid gland? No, they didn't do it. They just did some blood tests. And that art's another art that seems to be lacking. So okay, I'm going ahead and move on here. Now let's take a look for tongue diagnosis. So much information you can get off of a tongue diagnosis before you even look at the lab test on what's going on with the patient. Now this is very specific for a thyroid, so I want you to think thyroid as we go through these. Please keep that in mind. So you've asked the patient, look, I want to examine your mouth, and I want to look at your tongue. This is for diagnosis, and they fully understand. So now you have a patient that presents with a pale tongue. And the tongue is pale in color. So essentially what that means, from a functional medicine perspective, is that there is an iron deficiency going on. And one thing, I'm going to probably talk about this 3 or 4 times during this whole webinar tonight. If iron is deficient in a patient, like an iron deficiency in anemia, iron is a cofactor for one of the enzymes that's responsible to make the thyroid hormones. So think about that. If a patient walks in and says, there's known I have iron deficiency anemia, a lot of times they already know it, or you need to question that. I want you to think of the thyroid. Think, oh my gosh, there's an enzyme that's needed to make thyroid hormone. They're not getting enough iron, and I'll show you that a little bit later. So definitely keep that in mind. Okay, now instead of this tongue being pale, it's got a beefy or a thick. I've combined the next 2 bullets together, like a very thick tongue, a beefy tongue. So essentially, what does that mean? In Chinese medicine, is my understanding that means that's a sign of a qi deficiency. And one thing that I know about qi deficiency, a lot of the signs and symptoms are very similar to hypothyroidism. So I want you to use your knowledge and think about that as well. From a functional medicine perspective, we think of a thickening or a BP tongue as a B12 deficiency. Again, energy, something's going on. They're already hypothyroidism. Are they low on B12? A way to check that is certainly through blood tests. There may be a homocysteine test that you can take a look at. And this way questions you, well, maybe that's part of what's going on here as well. They just have a problem with B12 deficiency causing lack of energy. So you need to keep that in mind. Put that on your checklist. By the way, the tongue, when it thickens up in your hypothyroid patient, essentially, again, that's another accumulation of fluid, which you'll see on the edges of the tongue. They call it a scallop tongue, where it looks like you can see the indentation of the teeth on the side of the tongue. That's another sign, they're retaining fluid. Okay, so we're going to move on to another one here. You see geographic tongue. It's got a funny pattern on it. A lot of times that's just really blown off as, well, it doesn't mean anything. We'll take a look at that, meaning functional medicine practitioners, and think, well, is this a yeast infection going on here? You may not, it's really not out there a whole lot that, how can a yeast infection be involved in thyroid disease? I'm going to show you later that yeast infection can definitely be a contributing factor due to immune system dysregulation causing thyroiditis. It's really a neat thing that you kind of need to check off your list, and definitely check your patients for the possibility of yeast infection. We'll talk about that a little bit later. So now there's a white coating on the tongue instead of the other ones above. Well, that means from a Chinese medicine perspective, that's too much heat in the body and a sluggish digestive system's going on. Then we have the yellow coating on the tongue. What we look at with that is, hey, there's too much toxins in the body. Something's going on with the GI system as well. And remember that toxins can be from slow metabolism, endogenous metabolic waste, they're not eliminating properly, and a combination of environmental toxins. So you definitely need to keep that in mind. The last section of observation as we move forward is still looking at something very simply as the fingernails. Again, I've limited to two specific types of presentation of the fingernails, and that's the spoon-shaped nails. They look like a spoon when you look at them, the spoon shape on the nail. That's another indication of iron deficiency anemia. So you already know that, okay, if there's anemia, that enzyme in the thyroid's maybe not working well and not producing enough thyroid hormone, and that may be what you need to treat to help this patient as well as balancing their energy systems. Another presentation that, quite frankly, I see a lot is this thing called Terry's nails. What that is, the nail turns white and then there's like a dark band at the tip of the nail. That can give you an indication, is there liver disease, is there concomitant diabetes, hyperthyroidism, malnutrition, what's going on? So there's a whole bunch of things to look at in the nails, and functional medicine will definitely show you that. And the reason for me showing you this, basically, is just the power of observation. This is not only for individuals with known or suspected thyroid disease, but for all physiological disturbances. I think as acupuncturists, you all have the power of observation ranks high with your skills, and functional medicine just can tie that up, tie that together with what you're doing very, very nicely. Okay, so here's the approach for a functional medicine approach. Again, we need to look at the major body systems, and as acupuncturists, to add energy balance. So I probably should add that on the slide for this presentation, but I'm sure you all are adept at that. So what I want to do is we're going to go clockwise around here, start with gastrointestinal dysfunction, and just keep thinking of how each of these systems not only can affect each other, but also affect thyroid dysfunction, but other diseases. But we're going to limit it to thyroid. That's part of the webinar here, thyroid dysfunction. So I mentioned, like with the GI system, I gave you a little window before, and I know I'm repeating myself, but I think things will stick. With the GI system, you think about the malabsorption, nutritional deficiencies. Think about celiac disease, gluten sensitivity, causing those antibodies to go against the body's tissue, and particularly the thyroid gland. Candidiasis. I'll show you a slide, and I'll talk about yeast and how that's related. Now, as you go again clockwise, you go to the detoxification system. Like I mentioned before, the liver plays a major role in regulating the body system. However, it's the thing that I want to kind of drive home. That's where a lot of the peripheral conversion from the thyroid hormones, the T4, which is not as active as T3, that's where it gets converted. So a slow liver will decrease the amount of the 5 times more active T3 hormone and cause hypothyroid-like symptoms. So I hope this kind of makes sense to you. So the liver, by the way, just a wonderful organ to treat. There's one of my old teachers said, if you don't know what to do, treat the GI and treat the liver, and you're going to get most patients, chronic patients, well. I think there's a lot of merit to that. By the way, other areas of elimination of the body you definitely need to consider. We eliminate through the kidneys, we eliminate through the lungs, and also through the skin. But you need to consider the GI system. The GI system, to me, the colonocytes in the GI system, I kind of have this vision of little mini livers in there, because they are able to detoxify very similar to the liver. They're able to perform a process called biotransformation of drugs and toxins. So that's if the liver, again, if there's overload in the gut, there's overload in the liver, and you see how all these systems tie in. As we go down the list, there's oxidative stress. That definitely needs to be considered. You think of how does that tie into thyroid, thyroid disease? It does actually very nicely. It's interesting that when iodine, which is needed to make thyroid hormones by the thyroid gland, believe it or not, oxidation within the gland occurs during that process. Now, the gland is equipped with enzymes, thyroid enzymes in the thyroid, glutathione and so forth, that are selenium dependent, to help take these free radicals, the oxidative stress, and balance that out. Now, if there's nutrients are deficient, oxidative stress can take place, high levels in the gland, and actually produce nodules and neoplasms in the gland itself. So this is a very powerful thing to understand. Is when the body is out of balance. There's a chemical that's used in the thyroid gland, you may be familiar with it, called hydrogen peroxide. That needs to be converted to water in the normal functioning thyroid gland. If there's an imbalance somewhere, the extra hydrogen peroxide used along with iodine to create thyroid hormones will cause that free radical damage and damage the gland, which can lead to enlargement, nodules, and so forth. So these things definitely need to be considered in oxidative stress. I'll talk more about that on the slide. Again, you're going to see slides on most of these as we proceed through. Just kind of whetting your appetite here a little bit. As we go to the immune system, I'm going to be very specific on the immune system when I talk about it tonight. It's going to be mainly what's going on with the adrenal dysfunction. The immune system produces an immunoglobulin called secretory IgA that lines the gut, lines the eyes, lines the nasal passages, and so forth, that acts as a protective mechanism. And I'll show you how a low level of this immunoglobulin IgA relates to thyroid dysfunction. Again, that'll be on a upcoming slide. It's kind of a fun slide to look at. I already talked about nutritional deficiencies. Again, if the raw materials aren't there, tyrosine, zinc, selenium, iron, well, the gland's going to work overtime, cause more oxidative stress, and then it's going to enlarge. Now, the question you have, are the nutritional factors due to poor diet? Are they due to poor absorption? That's where you got to be a really good detective what's going on here. As we move up, you have hormonal imbalance, something for you to think about as well. It's interesting that hormonal imbalance definitely plays a significant role in thyroid function. Conditions such as pregnancy, if the patient's on estrogen therapy, oral contraceptives, if there's a genetic predisposition, or bowel dysfunction, which I'll explain in a few minutes, they can all create an imbalance, particularly of estrogen. Now, estrogen, high levels of estrogen can limit the amount of active thyroid hormone in the body. Now, isn't that kind of interesting? So, I've laid out, aside from the environmental factors, several areas of treatment, aside from energy imbalance, to look at on these patients to get them feeling better. It may be just one system that helps tweak all of it, or you may need to work on 2 or 3 other systems. My hope is that this makes sense. By the way, the GI system, here's something for you to think about. As the estrogens are metabolized through the body, they need, as they're eliminated, as they're used up, the liver does that job. Squirts it into the bile squirts it into the GI system. If you have a patient that's constipated and has dysbiosis in the bowel, guess what? The estrogens get recycled into the body, creating this high level of estrogen. So I want you to think about that. The treatment for that patient, maybe if they're constipated, treat the constipation. It can balance the hormones by itself. This doesn't need to be like existential, thinking here on, well, what can we do? Just getting some of those systems cleared up very, can be very simple and very effective. I treat a lot of patients, particularly with migraine headaches. They have constipation. We're going after that first. So that's another topic. The last thing I want to talk about is the environmental effects that the environmental toxins have on the thyroid. But interestingly enough, environmental toxins can get into the hypothalamus, pituitary, thyroid, and the hypothalamus, pituitary, adrenal axis. And I'll talk about that as we move forward. I know that was a lot on that slide, so we'll go ahead and move forward. All right, so let's take each one individually here. Candida's up here. Now, what I did, this is a Genova diagnostic. This is a test that they offer, and by the way, they're associated with Metametrics if you haven't heard of them. This is this is a sample test on what they do. So if you suspect a patient with Candidiasis, that would be, a patient comes in, they tell you, and I have chronic yeast infections, I have a history of a ton of antibiotics, been on oral contraceptives, or I've been on a lot of steroid medications such as corticosteroids. They're going to get real suspicious for, hey, is there a possibility of yeast infection? They have white, the white patches in the back of their mouth when you do the, examination of the oral cavity. So those would be like high on the list. The reason I'm mentioning Candidiasis is because the symptoms of chronic Candidiasis are very similar to those of hypothyroidism, as well as other conditions. Like here's some of the symptoms. You have fatigue, lethargy, foggy thinking, constipation, irregular menses, gas and bloating, a decreased libido, mucus in the stool, cold, hands and feet. Doesn't all this sound like it could be a lot of other things going on? But those, not necessarily Candidiasis, but those are the major symptoms of Candidiasis that can also relate to sound like hypothyroidism. So a thing you need to keep in mind is that fungal infections can affect the endocrine system. They can affect the pituitary, the thyroid, the parathyroid, pancreas, adrenals, and the reproductive organs. I know it sounds like a lot, but it certainly can. It's interesting to note in the literature, patients with chronic Candidiasis will frequently have elevated thyroid antibodies. That's the Hashimoto's thyroiditis. There is a definite connection there. It's something for you definitely to think about or consider. Again, if you notice that they have patches on their skin, as an example, there's another observation. The little red patches on your patient's skin as you perform acupuncture and your therapies, and think, what? I wonder, since they have patches on their skin, I wonder if that's a yeast infection, and I wonder if it's got to be systemic. It's on their skin. It's probably in their bowel and so forth. Again, that's another observation for you to think about. So another part of the GI system, I mentioned gluten intolerance and celiac disease. Again, just like it says here that with celiac disease, it is an immune-mediated disorder, and it has a whole bunch of symptoms to it. It's interesting that celiac disease and other autoimmune disease, it's clearly been established, and thyroiditis has been repeatedly associated with celiac disease. So again, another good, I do this to any of my patients that come in with known or have high antibodies for thyroid antibodies or thyroid disease. I'm going to immediately take them off gluten. I will test them for particularly celiac disease. It's good to have some hard copy data, but I can guarantee I'm going to take them off, and that's another avenue that you can address almost instantly. Say, see how they feel, see if their gut's feeling a little bit better. So that's something. There's such a direct correlation. I've been doing this for quite a few years. So like it says here, thyroiditis is repeatedly associated with celiac disease. That's enough for me to take known patients with known autoimmune disease, thyroiditis, this off gluten and gluten products, just about immediately. So what I did was I wanted to come up with like a mental image for you to think about gluten and how it can cause thyroid dysfunction. So here's I want you to think about it this way. So if you have a damaged lining in the GI tract, right, and then you're eating gluten and these proteins get in there, the gliadin and so forth, and now that the lining is damaged, I'm sure you've heard of leaky gut. This stuff gets through the gut wall. Now on the other side of the gut wall, there's all these immune cells kind of lined up, ready to protect the body so stuff doesn't get in. Remember that the gut, the lumen of the gut is not, it's outside of the body when you think about it. So if this gluten is getting in, it actually, the immune cells will recognize them, produce autoantibodies, self-antibodies, and can attack tissues of the body, in particular in this case the thyroid. So that's kind of how that works. It's oversimplification. I know I have on here, T helper cell 17 and that the T helper cell 17 and the that's the cell in the in the other side of that gut that will cause this reaction to take place. So you're welcome to look up T helper 17 cells, but essentially that's how this works. In our functional medicine training course, we're going to teach you how to look at gut physiology and how to restore gut integrity, so you have good knowledge about that. Now, the immune system that I have that I want to talk about is very specific. There's an immunoglobulin produced in the body called secretory IgA. So I'll talk about that in just a moment. I want you to take a look at this slide. You're going to see if this particular immunoglobulin goes low, look at all the conditions and the diseases associated with that. When you get almost down to the bottom, you're going to see one of the bullets is endocrinopathy. You go a little to the right, you're going to see thyroiditis, Graves' disease, diabetes, mellitus. Isn't that kind of interesting? What's going on there, and how can immune dysregulation cause that, which is what I want to talk about. Now, again, I'm going to repeat myself, but here's how it goes. The mucosal linings of the body, that being the eyes, the nose, the throat, and the gut, they have a protective barrier that's lining their surface. And that's produced by the immune system. You got to think of these immune cells producing this immunoglobulin. In this case, it's called secretory IgA. Essentially, its purpose is to block pathogens from crossing that barrier, getting into the body. So I want you to think about if a pathogen gets in, this immunoglobulin, think of it as this immunoglobulin, think of it as being sticky, able to bind the pathogen, so it just passes through the body and everything's okay. So when this system breaks down, not a thyroiditis can be created, but a list of other diseases can be created and are associated with this. So then the question is, okay, what can cause this protective immunoglobulin to run low in the body? This is where your history is going to come in. Are they on medications? Do they have past viral infection like Epstein-Barr? Poor nutrition, flat out, bowel disease? Do they have a load of a high antigenic load in the body? I mean, there say a lot of gluten. There are allergies to food allergies, latex allergies, which you need to kind of clear the way here. Another thing that can cause low levels of secretory IgA is increased stress levels and increased cortisol levels. Think of it this way: when that drops, things can now get into the body and create havoc on the immune system and create a plethora of diseases. So that's pretty much how we're going to look at that. Look at that. By the way, there is a functional medicine test. If you haven't heard of it, it's called an adrenal stress index test. That actually measures the amount of secretory IgA, cortisol, and an adrenal hormone called DHEA. So please, we talk about a lot of that in our functional medicine training. We address that test in great detail. So I don't want to leave you hanging here, so I'm going to give you some ideas. Okay, so if it's low, like what would you do or what would you treat? Certainly treat the GI system, make sure it's in good shape. Balance the energy systems of the body, reduce stress, take a look at the diet. You want to assess for environmental toxins, and you certainly want to evaluate and treat any adrenal dysfunction. That's how you would get this secretory IgA back up. Put the sentries back in duty, on the GI system, the eyes, and the nasal cavity, and so forth. There's a question that I get a lot about, okay, so I have a person that has thyroid disease and adrenal dysfunction. It's like, what do you treat first? And I believe this to be true. You always want to support the thyroid and treat the adrenals. I'm going to say that again. If you have both of those coexist, support the thyroid, and that can be by nutrition, by acupuncture, but you want to treat the adrenals if they're really out of whack here. The reason being, if you start, say if your patient gets Armour thyroid, they start taking supplements known to enhance thyroid. Now get them from hypothyroidism. Now the thyroid is working better. However, the adrenals can't handle it because it's burned out. So you're actually increasing the body's metabolism. The adrenals are burned out, and you're going to further burn them out. So there is a way that we have on our in the course, there's a way for you to tell. It's a very cool thing. It's just by body temperature. We have what's known as a metabolic graph, temperature graph that we use. Essentially, what that graph shows, you have your patient. There's a way to do it. I won't get into a lot of details because of time here. but you would have your patient take their temperatures 2-3 times a day, plot it out on a graph. If their temperature is spiking, like one day it's high, next day it's low, next day it's high, and it's like all over the place, that's a good indication that something's going on with the adrenal glands, as opposed to the temperature just. We discussed that in great detail. It's a really good tool. So I'm going to move off this and let's go to looking at the mechanisms of chemical disruption. Certainly this would be environmental toxins. They can also be food like soy, which I'll show you here in a minute. So what you're looking at here, if you look from top to bottom here, this slide shows like an overview of the production of the thyroid hormones T3 and T4. The simplest way to explain the thyroid hormone production is that the element of iodine, as you see in red, is chemically added to tyrosine, that's the TYR, right, through an enzyme, TPO, that's thyroid peroxidase. Now that's the one that needs iron, by the way, for it to work properly. So if you have an iron deficient patient, that enzyme's not going to work properly, and you're not going to go downstream, as you see on the slide, to produce the 2 thyroid hormones. It's going to be very inefficient. So you can take a look at that as well. If your patient is hypothyroid, if you look to the right, you're going to see soy there. Now the isoflavones in soy, genistein, and some of the phytoestrogen can actually block that enzyme as well. So if you have a known hypothyroid patient, you certainly want to advise them, perhaps if they're eating soy, stay away from it, because that's the exact site where patients with hyperthyroidism and Graves' disease, that's the site of that chemical you see up there, the 6-propyl-2-thiouracil. They actually try to block it with that. It's like an inhibitor, but you can look at some of the natural agents that can also do that as well. So you need to know that. On the left, you'll see in red that there's this is the NIS disruptors. Now what that is the sodium iodine symporter. It's got a fancy name to it. But there's chemicals out there in nature, in normal and not normal, perchlorates, thiocyanates, and nitrates that can actually block iodine from getting in. So you need to know about those as well. I'm going to check my list here. So certain chemicals, that's how they can block thyroid function and thyroid hormone production. One thing that if you get, this is not the time for me to get into great detail, but when you're thinking about thyroid, I'm sure you're all familiar with, it starts with the hypothalamus, goes to the pituitary, then goes to the thyroid, and then of course you have the adrenal in there as well. High levels of body toxins and high levels of stress in the body will cause the hypothalamus to shut down. There's a word I want you to write down. I don't have time to explain it here, but it's called obesogens. Now, certain chemicals, environmental toxins, can decrease the function of the hypothalamus. Think of what happens to the rest of the body. They're called the rest of the body's glands, endocrine glands. Think of the patient that can't lose weight. You've tried everything. They may be toxic. That's why I'm going to mention about infrared saunas and so forth. So, these chemicals, environmental toxins, they can cause, hypothyroidism, hyperplasia, the gland to grow, and also cause cancer, as you probably all know. Next, I want to talk about the oxidative stress. Now, some people define that as a imbalance between pro-oxidants and antioxidants. The take-home message here is that the body needs oxygen, but while it uses oxygen, it creates free radicals. So you have to squelch those free radicals so they don't do tissue damage. That's where that balance comes in with good food, all the food that that is high in antioxidants, fruits and vegetables, and more fruits and vegetables. You already know that. So definitely need to look at the diet. When it comes to the thyroid, again, I'll mention this again, that the production of thyroid hormones causes oxidative stress inside the gland. So if there is an imbalance going on in that gland, a nutritional imbalance, in particular like selenium, malnutrition, oxidative stress high levels can take place in the gland, and then you get metaplasia, and then you get nodules, single, multiple nodules, all kinds of stuff can happen. So that's another thing for you to consider. I like to think of oxidative stress as the skin, on that person that's been smoking for 30 years. It gets all wrinkly. Well, that's what happens inside the gland as well. So there's a little pearl that I have on here. This has served me well throughout the years. And here it is. Failure to recognize the presence of thyroid dysfunction in diabetics may be the primary cause of poor management often encountered in the treatment of diabetes. What that means, a patient comes in, they say, they just cannot get my diabetes under control. I've tried this, I'm on metformin, now I'm going to insulin, and they forget to look at the thyroid. That's usually the key. So if you don't remember anything tonight, please remember that. That has served me well throughout the years. This other slide here, this is that, I just wanted to just show you that iron again, what's going on. This is the thyroglobulin right here. This is the, the protein with the, where it's kind of like the ladder where things get built, or the house where things get built. This is the tyrosine, amino acid that's needed to make T3 and T4. There's iodine coming in. There's hydrogen peroxide. Again, if that doesn't get converted to water, that's a sign of oxidative stress right there, free radical damage. Again, this is the enzyme that's needed. That's heme or iron containing, like I mentioned before. So iron deficiency will cause this thing not to move forward and create T3 and T4. So have a look at that. And you remember before I talked about, the tongue is pale, could be a sign of iron deficiency, anemia, spoon-shaped nails, and so forth. So definitely have a look-see. Another pearl that I probably should have written down on here is that if you have a patient that is known iodine deficiency, an iron deficiency can impair iodine supplementation or the use of iodine. So that's another thing. A lot of these docs out there are just giving their patients a lot of iodine, which is not a good idea because it can actually cause autoimmune disease, add to it in high doses. So, I always think about iron deficiency. And by the way, when you think about iron deficiency, you need to think about what in the world is causing that. Is it malabsorption going on? Is there inflammation in the GI tract, microscopic bleeding, that they're losing it? So that also needs to be questioned as well. So we're getting close to the end here as we move forward. So here's essentially is your checklist. This is what we do as functional medicine practitioners. We go through our little gamut, do our little checklist. I know it's a lot, but if you do it a few times, you'll get it. Make sure what areas do you need to look at, and then I'll show you the algorithm after this slide. So this is kind of like a review. So you're looking at thyroid dysfunction. You're thinking about, of course, the whole hypothalamus pituitary thyroid and the hypothalamus pituitary adrenal axis. Why you're thinking about all this. So I know it's a lot, but again, review the nutritional deficiencies. Are there enough supplies to make thyroid hormones I talked about? Is there enough tyrosine, iodine, iron, selenium, and zinc? Or are they available? So you need to have that in mind. Gastrointestinal dysfunction. Is there celiac disease? I talked about candidiasis. Is there hypochlorhydria? Again, where they're not breaking down protein and so forth. Is there H. pylori involved? That's areas that you need to think about, and I'll show you how to check for those in the next slide. Adrenal gland status. How are the adrenals doing? Is there a proper amount of cortisol? Are they under adrenal stress, which converts the active T3 again to reverse T3, which gives you signs of hypothyroidism. The adrenal glands are trying to put the brakes on the body, slow it down. Too much stress. Handling stress can actually help that conversion go the right way to the active T3. You need to think about that. The liver. Are there signs of gallbladder or liver dysfunction? Something that I did mention before is that the gallbladder is needed, bile is needed for the breakdown of fat-soluble vitamins. It just so happens that vitamin A is, without getting into great detail, is actually part of the DNA receptors. Vitamin A gets into the cell, it's part of the receptor site where the thyroid hormone will get through the cell, activate the DNA of the cell, of each cells of the body, to produce the metabolism. It's a messenger. Vitamin A is needed for that. So that could be another dysfunction as we look at the liver. So you definitely need to question that. We talked about immune system. I talked about that a lot. Is there evidence of chronic inflammation, other autoimmune diseases going on with the patient? Again, the GI, most of the immune system found in the GI tract. Environmental toxins. Are there heavy metal exposures to the patient? By the way, heavy metals such as lead and cadmium can displace iron in the body. That could be why the patient is iron deficient, because they have too much lead. My wife is an artist, and believe it or not, they work with lead and cadmium. So I'm constantly giving her supplementation, and I have a infrared sauna. That's why I know quite a bit about it, just to protect her in her career. So we use that. Oxidative stress, I talked about that. It's important to have good balance. But also remember, oxidative stress is associated with diabetes. There's definitely a connection there. Medications, you need to know what medications your patient's on. Through functional medicine, we also train you on medications that can cause nutrient depletion. I think you hear a lot of the commercials that statins will deplete coenzyme Q10 in the body. Coenzyme Q10 is needed for energy production. So that could be a source right there. Thyroid medication, you need to know what kind of medications your patients are taking, how much and dosage. That's important. You may not be prescribing those, but you need to know, because as you get the patients feeling better by checking these systems, the medication can be a detriment. They may not need it, and the hope is that they don't, unless the thyroid has been removed. That's another story. So think about, particularly, I'm mainly focused on hypothyroidism. Just think about it in three phases. There's a primary hypothyroidism, which is a problem with the gland that you're going to see about 95% of the time. So those are good odds, and then it's autoimmune related. So it puts you in good, a good line of thinking. Autoimmune, 95% of the time, hypothyroidism. That's kind of a good ballpark to think in as you start working with your patient. The other types is also known as secondary and tertiary. You do need to know about those. Secondary would be, there's a problem with the pituitary gland, particularly the anterior, not giving the signal, that's thyroid stimulating hormone, to the thyroid. That can be caused by a tumor. It's kind of rare. The third type is quite common. I know I said 95%, but this is getting close to the other 4%, and that is called tertiary hypothyroidism. What happens is that the hypothyroid says, man, there's too much stress, too much environmental toxins, and I'm just going to shut down. And that can happen. And that will shut down everything from the hypothalamus, the hypothalamus straight on down, as you probably know. Things that can do that are environmental toxins. Some drugs can do that. Lithium, dopamine can certainly do that. So you do need to know about a list of medications that your patient's taking. This will be the last slide. This kind of sums it up. I tried to get as much in as hour as I could, and hopefully I wasn't going too fast. I know I was talking fast, but you get an opportunity to look at this again. Dr. Grisani is going to email this to you so you can look at it again, slow me down, take notes, do what you need to do so you can get more out of this. So here is essentially the algorithm, functional medicine algorithm that we put together. You look at the top, always consider balancing the energy, which you already know about, thinking about the HPA axis. And with these patients, from my experience, if they've been diagnosed with hypothyroidism or thyroid dysfunction somewhere, you got to let them know, hey, look, it may take 6 to 9 months for you to get feeling better. A nice rule of thumb that I use for patients, I usually ask them, how many years have you been feeling this way, like for chronic disease? Well, if they say 5, say, okay, well, is it reasonable that 1 month for every year that I need 1 month for every year you haven't been feeling well? Does that sound reasonable? Most of the times they say, yeah. So give me 5 months to work on you. We'll work together. That kind of settles them down that they're not expecting results, especially with something, this magnitude, to get fixed in a day. Because most people, like all of us, want to get fixed in a day. So, of course, you see here in the red, you see you got to get a good history, physical exam, look at their past records, look at their recent blood chemistries, find out what's going on. You definitely want to look at that. A lot of these patients have already had antibodies testing. If their physicians have been astute, most of the times what I see in my practice is when they wind up coming to me, the doctors just look at TSH, and that's not going to tell you a whole lot. You need to have the full panel. We'll teach you on what the full panel is. Some of those patients may need some, as you look in the purple there, they may need some thyroid hormone replacement. That's the THR. May be necessary just to help them, providing that they're not in adrenal fatigue. You want to use a temperature graph, which I talked about. Very, very good tool. We have that, certainly have that on our website. The other areas talked about, look at GI function. There's a stool analysis that can be ordered. We teach about that. That can check for like H. pylori, Candidiasis, digestive enzyme dysfunction, pathogens, whatever's going on. If you need to confirm a celiac test, you can order that. That's via blood testing. I talked about the adrenal stress test to look at cortisol levels. Make sure that the adrenals aren't stressed out. shutting down that more active T3 hormone I talked about. The organic acid test, that's a urine test. That could look at oxidative stress levels in the body and also DNA damage. It's a really cool test to do. I get a lot of information on that. It also looks at GI function. It's a really non-expensive test that gives you a lot of good information, even about nutrient status. So if you're not familiar with an organic acid test, feel free to Google that, have a look-see. Iron panel, I talked about iron, at too much already probably. A homocysteine, that's a test that can look at B12, or you can do a vitamin B12 test. The hemoglobin A1C, I'm sure you're familiar with that. That shows sugar regulation or dysregulation over a 3-month period in the body. Really good test to look at, keeping that connection between blood sugar dysregulation and thyroid problems. So before you start detoxifying, you want to make sure that the nutrient levels back up, the antioxidant levels back up in your patient. Trust me, if you start detoxifying the patient like right away, hit them heavy, detoxification is extremely energy dependent and nutrient dependent. You can actually drive their thyroid and adrenal system back down and give them one heck of a headache that could last several days. So you want to make sure, that's why this is kind of broken in. This is second area, you go slow. I mean, you have to make that clinical decision yourself, but you can use the infrared saunas that I want to talk about, which is why that's on there, because you're not giving the patient anything. If the patients are okay to be in a sauna, they don't have cardiovascular disease, it's a great way to start out detoxifying while you're treating the first areas. So hopefully you got a good idea of what's going on here. And I'm going to talk about infrared saunas in a minute, but I just want to do a summary here. And basically, the best thing I can tell you to keep in mind that there is no one-size-fits-all, even with the protocols. This is the art of this, just like the art of visualizing your patient, knowing what's going on. The tests are great, but treat the patient, not the test. Again, this is coming from me. Others may disagree, but that's kind of how I feel. It served me well. I use the test certainly as a compass or a guide to monitor treatment. I use the temperature graph to monitor my treatment. And keep in mind that every patient is an experiment with no controls, and each person is biochemically different. Those are the tenets of functional medicine, and I suspect of traditional Chinese medicine as well. So you have the tools, the investigative skills. We shared those with you, and treating thyroid from a functional medicine perspective. I hope you've gained a lot from this webinar, and a little bit more insight into treating thyroid disease from a functional medicine perspective. Before I talk about infrared saunas, I want to mention that you can subscribe, and this is for free, to we have a thing called Clinical Rounds. What this can do, and it is free, you put your your email in there, and what they are, they're actual case studies that will introduce you to functional medicine, and all you got to do is drop your email in, and then we can send them to you. You can decide on, hey, does this thing seem like it fits into my practice and what I'm doing. So as I promised, it's only going to take less than a minute, maybe 2 minutes here. I wanted to give you some insight into the use of infrared saunas, and particularly the difference between two, near infrared and far infrared. Okay, near infrared uses lamps, and far infrared uses heating elements. And so kind of keep that in mind. So with near infrared, they are electromagnetically safer because they don't require the heating elements. So with the far infrared, you're essentially putting your patients into an electromagnetic field, which some people think that it can cause more stress on the body. I particularly think it does. So I like using the near infrared, which are the lamps, and I would definitely want to share that with you. Another thing, the near infrared, the frequency of the wavelengths, they can penetrate deeply into the body. You can pretty much target the body. You can target it in the liver, essentially located like onto the abdomen. And so I believe that they are a lot more, they're superior. I mean, if you just, the far infrared, which with the heating elements, that's okay, but keep in mind the electromagnetic radiation that can be from the wires. With the lamps produce colors, and the colors, the red, the orange, and the yellow, that range appears to stimulate the organs of elimination, the liver, the kidneys, the large intestine. So I think that's really a cool thing. So if you consider your patient is toxic, detoxification problems, and you don't want to give them supplementation right away, but man, you got to do something. Think about the use of the near infrared, which is the lamps. for sauna. So you can kind of look that up, and near infrared, think of lamps, and then use that type of sauna. So I think I've talked myself out here. Thank you so much for listening, and I hope this was helpful. And Ron, I think I out-talked you tonight, buddy.
No, I did a great presentation. I'm gonna just close with one quick thing here. Let me just.
Sure, it's all yours. I'm done. Thank you so much.
Thanks, Wayne. Thank you so much. I just want to just mention real quick that FMU, for people who are relatively new to our presentation this evening, we are an approved CE. Excuse me. We're been approved for postgraduate education for acupuncturists. But very important, we've also actually went the extra step, and we are approved both in Florida and California. As you know, there are different requirements in Florida and California. So just wanted to just close with that. But I want to thank everyone this evening for participating. I hope it's been very valuable. This will be recorded. I'll be sending an email probably tomorrow, at least within 24 hours, so that way you can review the presentation. I see we have a few questions. What I'm going to do is I'm going to make a suggestion here. We're not taking questions, but I want to encourage everyone to go to fmusupport.com, fmusupport.com, and if you have a question, go ahead and just go to fmusupport.com, and you'll see when you get there, it'll actually have different categories. Go to clinical and just post your question there. We will promptly get back with you and answer the question. But I want to thank everyone again. Thank you so much. Have a great evening. Take care, everybody.